The state's legislature is back in session and all eyes are on test scores in public schools. Many of the incoming freshman legislators campaign.
Many local school districts are keeping a watchful eye on increasing enrollments and budgets that are not keeping pace. With more students and fewer...
The districts know they have very little choice but to invest in their leaders. The expectations have continued to go up. They're expected to do more with less. Less personnel, less materials, less resources. So it really behooves them to really invest in their leaders and to provide support for them, because that's how you're going to increase the capacity and increase productivity. Leadership is essential, and when we get the data back, what we want to do is to look at four things as we're trying to improve the health of an organization. What is a leader doing, and what does he or she need to do differently? What do team members need to do differently? And do we need to change the structure so that we have more systems in place? And sometimes just a matter of explaining why we do what we do. Now, all four of those are directly under the influence of the leader. Members of the team cannot change what they do systematically unless the leader changes his or her behavior. So that leadership is essential, absolutely essential. We provide a very comprehensive data-based approach to leadership development, and we can provide data that helps them look specifically at what's happening in their organizations. What we want to do is help them help their most effective leaders impact the entire organization. And we can also focus our energies and their energies on those leaders who need to change what they're doing and how they're doing it. We have saved the professional career of many leaders, because we can help them look at the data and we can help them dramatically change how they lead. Our conceptual frameworks give a great roadmap for principals or any leader to change his or her behavior. We can help them change their behavior in such a way that they can grow themselves and also build the capacity of their leaders. As a matter of fact, just this past week I was talking to a principal who said, I had never thought about the fact that I might be viewed as a controller of people rather than developer. We think this works great for people who love data and value people. We want to help you grow people. That's our commitment. We want to help you grow people to be effective leaders. Well, we have 10 dimensions because Matthew Miles created a conceptual framework about 3 decades ago. And he said that the health of an organization can do two things. One, it can help us predict the success of any plan change effort, and can also help us improve the productivity of a unit. We visited with Matthew Miles. He encouraged us to operationally define organizational health. We then took 3 years. We went through all of the rigor of test, retest, and reliability. And this is not just a survey. This is a valid research instrument that has been designed to collect data that is reliable and valid. Furthermore, we now have predictive validity, which is the very highest kind of validity, because we can predict the success, we can predict the level of performance of any school based upon the health of those units. So our process allows them to maximize their time and energy and dollars. The big three are goal focus, cohesiveness, and adaptation. Simply stated, if people know where they're going to go, are willing to work as teams, and willing to adapt and change, we're going to have effectiveness. Those are the big three. We call them the big three because they have typically correlated the highest with student performance. And so we can tell you whether or not your people are at the clarity level, or at the acceptance level, or support or advocacy. At the clarity level, all they say is, well, we know what he wants or she wants, but that's not realistic. At the acceptance level, they're going to say, yes, we know what he or she wants, and we agree it's important. But at the support level, they're now saying, we believe, our goals are. At the advocacy level, they are willing to hold themselves and others accountable for their goals. So you can see why goal focus is so critical. The reasons Victoria has been successful is because the leader came in and he utilized the talent of who he had. He built trust and confidence. He used the data as a powerful tool to help people see a need to change. He did not misuse the data. He used it as a way to help people have power with. They had confidence that he was there to help them grow and change and develop. So within a 5-year period, there was dramatic change, from high dependence on leaders to high independence, and today most of those schools are working interdependently and they're having phenomenal success. Our knowledge about leadership is sometimes ahead of our practice. So what we are trying to do is provide frameworks so that our knowledge and application are more consistent. We think that there's a body of knowledge, and we think our conceptual frameworks capture that. We think we have synthesized the research out there. We think our models tap into the very best out there in the field, and allows us to move people from dependence upon the leader to independence to interdependence. So we think our conceptual frameworks allow us to move people and build on that capacity and create those spots of excellence and expand those.
Organizational Health's results-oriented process and team of experienced consultants are making a big difference in school districts across the United States. Let's talk about how we can help you develop leaders in your organization. Call OH today at 972-966-6197.